Texas yields back his time. The gentleman from California.
Madam Speaker, I yield such time as I may consume.
The gentleman is recognized.
Madam Speaker, let's remember why we're here. Less than 2 weeks before Christmas, and we're talking about whether or not 10 million children, the children of hardworking American families, where we know that the cost of health care has increased, we're talking about whether or not 10 million children, 2 weeks before Christmas, will have access to health care. Madam Speaker, the bill we're attempting to override is a responsible bill. It does not increase the deficit in providing health care access to our children. It is completely paid for. Madam Speaker, this bill speaks for itself. Regardless of what's been said by either side, read the bill. It speaks for itself. This is about children's health care, and it's only for children who are citizens or are legally in this country. And it is for modest income Americans who are in this country. Madam Speaker, let some numbers speak for themselves. 43, 100, 10 million. 43. That is the number of our Republican colleagues who voted on a bipartisan basis to override President Bush's veto of this children's health care bill. 100. We have been in the process of talking to our Republican colleagues and trying to resolve our differences for over 100 days, as the gentlelady from Illinois, Ms. Biggert, herself stated. 10 million. That's the prize. 10 million children in this country who will not have access to health care if we don't do anything. They simply want to have the same access to health care, to a doctor, to a clinic, or to a hospital, the way the children of every member of this Congress has access to health care. No member of Congress stands up and complains that at taxpayer expense we are making available to each and every one of us a health care policy which today and on Christmas Day will ensure that our children will be insured if something should happen and they need to go to a doctor or to a hospital. Is there any reason why hardworking Americans just don't earn enough money to pay for the full cost of that health insurance shouldn't have the same access as each and every member of Congress has for his and her children today? Madam Speaker, I hope we all keep our eye on the prize. 10 million children. 10 million children who are trying to make sure have access to health care. If members of Congress can guarantee our children health care, then we should be prepared to guarantee that anyone who works in this country can provide health care to their children. That's what this is about. We're going to return to the people of this country the Congress they feel that they've lost. We said a while ago that this Congress would take a new direction. That's what we mean when we mean to override the President's veto. I urge my colleagues to vote today to think about 10 million kids right before Christmas and say to the President, we will override your veto. With that, Madam Speaker, I yield back the balance of my time.
Without objection, the previous question is ordered on the motion to postpone. The question is on the motion. Those in favor say aye.